For many of us, going to work in the dark and coming home in the dark is the norm. As the days get shorter, there are some people who get clinically depressed. For those diagnosed with seasonal affective disorder, there is hope. Dr. Christina Davis of the Golden Wellness Center joins us today to tell us more about the disorder and the treatment to help those who suffer from it. Hi, Dr. Davis.
Hi, nice to meet you.
Nice to meet you.
Same here.
Let's talk about seasonal affective disorder. I think everybody has a kind of a sort of idea about what it is, that they just think, okay, it's dark, and people get sad.
Well, they think of the winter blues and the blahs, which is a milder syndrome. And that syndrome has a classification. It's called syndromatic syndrome, which definitely has the same problems initially. And then the gradations reach all the way to a level where you're so depressed you can't get out of bed. It affects your work habits, your sleep habits, your eating habits. It can cause anxiety, craving for carbs, definitely weight gain during this time. And the worst possible effect is where you can become violent and so irritable that you abuse the people around you.
How do doctors diagnose seasonal affective disorder? Because, you know, it's quite common for people to get the winter blues. Like you said, you lose sleep, crave carbs. I mean, I think a lot of us do that.
It's been misdiagnosed a great deal. There are three hypotheses. One of the hypotheses is that you are lacking melatonin or serotonin, depending if you can't sleep. If you can't sleep, your brain is not producing the melatonin. If you are sleeping, you're producing too much. And if you're producing too much melatonin, you become very depressed. So there is a regulator for that. We believe in light therapy. When I say believe, it's already been proven by Dr. Rosenthal in 1986 from his research that it does work. And in JAMA, many things have been written up. Three hypotheses again. One of them is they hypothesize that if you have serotonin deficiency, you will crave the carbs. And that's one of the reasons why they can say, okay, but you're craving carbs constantly between fall and winter, then you might have it. Again, a might. So sometimes blood work is the result of that. Maybe you need a blood work, maybe you don't, because if you keep a record on your own of what the problems are as they incur, and you know that it's a cycle that you're repeating every fall and every winter, 90% of the people that have it would know.
So how do we get more serotonin then? Is there a pill?
Actually, there is a way to do it. With light therapy, and what we practice at the Golden Wellness Center is color light therapy. There are definitely brain fibers that are attached to the eye and the optic nerves that regulate what we call the biological clock and absorb the light. We definitely are biologically people that need light, just like a plant, the photosynthesis of a plant. We absorb light, and when we don't have the light, we're not really balanced emotionally or hormonally. And so we need the serotonin, and when you're looking at light, say the color light of green, it immediately starts to produce the serotonin in the brain. It relaxes you. It's like looking at the green grass at summertime.
So a green light?
A green light. A green full spectrum light.
Yes, I was going to say, can we just get a light bulb at home, put a little green gel over it, and stand in front of it and look at it?
Actually, it would help to put, if you had the sun, units of light are measured in lux. The sun has 10,000 lux units. We have 2 different filmings of people that are definitely in the seasonal affective disorder syndrome, 2 major stages where they're actually absorbing the light, and you can see the difference in them within 15 minutes.
Are these lights portable? Because
some of them are
how
portable.
How do we get treatment?
You get treatment of going to a facility where they know how to gauge it. They take a complete history of your problem, when it is started, maybe when you were a child, and if it's a chronic problem, that can become a chronic problem because if it's gone untreated since childhood, probably there would be a definite misdiagnosis by this time as an anxiety disorder or a mood swing disorder or a mood disorder itself. And that's unfortunate, but that has happened in the past. What we can do is recommend that they have the light, portable light at home, but come in for treatment for the color light, which unfortunately right now is not available for home.
Children affected by this?
Yes.
It can start at a young age?
Yes, it can start at a young age. Usually it starts on the onset of 15 to the age of 43. And in that age, the ratio of women is 3.5 to 1 male. Before that, the ratio is balance between the genders.
And you found that child abuse victims sometimes, or more often than not, are the parents?
Have parents that have this disorder left untreated. It can go to the stages where you can become extremely violent and not know why. And the coping power in the wintertime is minimal compared to the summertime when your children go outside and you let your pets out. You seem to have more freedom, but the truth is you have more light.
Alcoholism has also been associated with this disorder?
Yes, it has. Alcoholism and drug use and recreational drug use has also been associated with this disorder.
So for people who are watching right now who think this kind of sounds like me, what steps should they take? Who should they go see?
They first should see their medical doctor, and the first thing they're going to be told is to keep a record of it.
Right.
One of the tips that you need is if you're sluggish around this time of year, if all of a sudden you become very moody and irritable, or you start with an anxiety disorder, it's very probable that you have the disorder. Once you find that you have this diagnosis, then seek help with a qualified practitioner that give you light therapy.
There is hope. Light at the end of this tunnel.
Absolutely.
Thank you, Dr. Davis,
You're
very,
very
very
welcome.
much. And if you would like to learn more about seasonal affective disorder, you can reach Dr. Davis at the Golden Wellness Center at 215-887-9901 or check out their website.